The number of hospital beds in our Colorado is not keeping up with the growing need for medical help.
More and more people, especially millennials, can't afford primary health care. Denver 7's Mitch Jelniker shows us the challenges growth creates for hospitals in our Colorado.
So we have your kiddo's head right here.
There's not much more exciting than to see your unborn child in an ultrasound.
That's the placenta right there. It looks normal.
Except,
Want me to listen to the heart?
maybe seeing your unborn baby brother.
So, yeah, look at that baby.
The Inner City Health Center in Denver has been serving the metro area's underinsured population for 35 years. The underinsured includes those who don't have insurance, as well as those with premiums and deductibles so high they can't afford primary care.
We try our best to reduce barriers to accessing high-quality health care.
Chief Executive Officer Craig Burleson says the clinic sees 20,000 dental and medical patients every year. And as Colorado grows, so does the need. The biggest growth, 20 to 30-year-olds who work multiple jobs in the service industry.
Really, they qualify as being poor or low-income earners, but in that age group, they don't see themselves as poor. They see themselves as being broke.
To keep up with the increased need, the Inner City Health Center is now in the middle of a campaign to fund an expansion.
We're trying to grow our facility and elevate the quality of care that we provide, in addition to accommodating an increased number of people coming to us for care.
Population growth has been a big driver of within Colorado, and we've seen hospitals have to adapt over the last 5 and 10 years.
The Colorado Hospital Association's Chris Tholen tracks trends in the healthcare industry that are leading healthcare providers to expand. He says the 3 big factors driving Colorado's hospital growth are population growth, the expansion of Medicaid 4 years ago, and believe it or not, tourism.
And so we're seeing more visitors who have accidents, sickness while they're on vacation.
17 new hospitals have opened up in Colorado just in the last decade. The number of beds is up 4%, but the need is up more than 6%.
We're seeing more and more hospitals reach capacity at different points in time.
To drive that home, take a look at this. This is where most of Colorado's hospitals were back in 2008. In those blue areas is where we've seen most of the population growth over the last decade, especially from Castle Rock up to Loveland. And that's also where we've seen most of Colorado's new hospitals pop up. And there are more still to come, like this one being built in Greeley, right along US 34 near 65th Avenue.
Well, I think this is the growth part of the city.
President Marilyn Schock says the decision to build in Greeley was an easy one.
About a quarter of our business over at MCR, Medical Center of the Rockies in Loveland, and Poudre Valley Hospital in Fort Collins, are Greeley and Weld County residents. And we are hitting some capacities at those hospitals.
While there's not much inside right now, it's expected to open to patients sometime in the first half of next year. And it likely won't be the last, as healthcare providers expect northern Colorado to continue to grow. UC Health's Longs Peak Hospital opened in Longmont just last year, and Banner Health in Fort Collins is offering more services, most recently partnering with the MD Anderson Cancer Clinic to expand care available.
Do you want to take a drink of water?
While getting care near the home may be important to patients, providers say what's important to them is making sure everyone who needs it gets it, regardless of where they are or their ability to pay.
This was an important opportunity for us to increase that knowledge and let people know we're here and we're ready to serve them.
And the Inner City Health Center has a jazz fundraiser coming up in a few weeks. You can check out the links in this story on thedenverchannel.com to find out more.